Moving to Florida, don't just change your address, change your health plan, or if you have Medicare Supplement, change just your prescription plan. There's a 63-day window to make this change anytime that you move. Welcome back to Medicare Uncomplicated. My name is Sebastian Correa. I am a local health insurance broker here in Ocala in the Villages, Florida. In this video today, I'm actually going to show you how to best maneuver this strategy to change plans and why you might want to change plans. Let's uncomplicate your move together. So let's start off with some of the basics. Let's say you're moving and you're moving just right down the street, but it's a different zip code, potentially a different county. If you're moving from a different county to a different county, you have the opportunity to change your Medicare plan. So if you're on a Medicare Advantage plan and you just haven't been happy and you feel like you've been locked in from day one since you got this insurance plan and you feel like you have to stick this insurance plan for the whole year, this is that opportunity. You've got that 63-day window. If you're in a Medicare Supplement plan, you really don't have to make changes if you're within the state. But if you are moving from county to county and you have not been happy with what your prescription drug plan covers, don't change anything with your Medicare Supplement plan, but look at the opportunity to see if maybe there's a better prescription drug plan that can actually benefit you if by chance your formulary is just not covering certain prescriptions. So let's go back and talk about Medicare Supplement plans. You're only going to be looking at the opportunity to change that prescription drug plan. The three most common reasons I would consider changing a prescription drug plan. If you're moving out of the state, always have the chance to look. This is very easy for you to even do by yourself. You can go on Medicare.gov, go down to the drop-down menu that says Part D plans, type in the zip code of your new location where you've moved, and you can search all the different plans and what the cost and prices are. You'll be very surprised on how the cost will vary from state to state, county to county. Another very important thing that you can also do on Medicare.gov if you're looking at just changing your prescription drug plan is look at the formulary. Make sure that your prescriptions are in the network or in the formulary, and also take a look at what tiers they are, because that's going to determine if it's worth considering a switch on a prescription drug plan. So once again, you don't have to switch, especially if you're moving from one county to another. I would recommend always looking if you're moving from state to state. But if you have not been happy and you are moving to a different county, it's worth looking into a different prescription drug plan. Now let's talk about you have a Medicare Advantage plan. And if you're happy and you're moving from one county to another in Florida, for example, I would not change a thing. However, if you have not been happy with what's covered, if maybe there's a doctor that you wanted in network and you now want to see if a different plan will cover them in network, it's a fantastic idea to now look and make sure that you can go ahead and see those doctors in network with a different plan. You have this awesome option of a 63-day window where you can now explore these options. Now keep in mind, if you are moving from a state to state, I 100% believe you should be switching to a different Medicare Advantage plan. There's two reasons why, really. The first one is if you're switching from a Medicare Advantage plan from, let's say, New York, and you're moving down to the Villages, Florida, the Advantage plans in Florida are very likely going to be richer and also cover the in-network doctors that you'll be seeing in Florida. If you have a Medicare Advantage prescription drug plan that is a PPO plan, you can't continue to have that plan and you might still be able to see some in and out of network doctors. However, if you are moving, it's a really good idea to just look to see if it's worth it. But here's where the tricky part is. If you have an HMO plan, so it's a Medicare Advantage HMO plan, my suggestion is you should definitely look at changing. The HMO plan that you're probably on from one county to the other might be different. The network might be completely off. Maybe a doctor, even in a different zip code, you might just notice that it covers a different set of networks with a different plan versus staying in the plan you're on if you're not happy. When you're on an HMO plan, keep in mind, if a doctor's out of network, you're paying full price for that doctor. So you're not going to be able to see those doctors unless you switch plans. Now, this is the question that does come up with Medicare Advantage plans often. And I get a lot of folks, especially here in the Villages, that they're still Snowbirds. Well, if you're a snowbird and you're planning on traveling back up north for about 4 or 5 months, maybe even 6 months, that you're coming back down, and you've already decided you want a Medicare Advantage plan, do not for any circumstance consider going into an HMO plan. My strong recommendation is go for a Medicare Advantage PPO plan where you can see doctors both in and out of network. There are also some options in some counties where there is something called a POS plan. These are very unique, and you would want to make sure your doctors are in network when you go out of the state. But HMO plans are not recommended. Very likely if you're in an HMO plan and you're going out of the state, that network is just the networks for HMO plans are very limited, very strict. You cannot see doctors out of network. And also it's really meant for people that are staying within a certain area. Lastly, on the Medicare Advantage plans, you will be very surprised that if you're moving from one Advantage plan to the other, the formularies of these, the prescription part of that, might be completely different. Sometimes the prescriptions are much better on one plan, the deductibles are probably better, or they're worse. So really get with a broker to explore some of these options that you have in this 63-day window and see if, well, while moving, you can make this jump to a better solution for your health. Now, in certain circumstances, some people are not necessarily moving. They actually get a letter in the mail saying that they either qualify for Medicaid or they've potentially got some sort of additional help. And that opens up a different special election period, or SEP. And if you want to learn more about those options, check out the next video.